Hi, I'm Dr. Anshumala Shukla. I'm a gynecologist, laparoscopic and robotic surgeon working at the Kokilaben Dhirubhai Ambani Hospital for the last 11 years. Today's segment that we would like to speak to you about is essentially about empowering women, considering this is the Women's Month in March, as well as creating awareness for a very enigmatic disease, which I would call, if you've heard of the emperor of maladies, the cancer, this is the empress of malady because it affects more than 10 to 25% women across the world. And the saddest part is that it is not diagnosed for more than 7 years. Therefore, today's topic, which I would like to enumerate about and would love to have questions from you on, is about endometriosis. And the good cells which are growing inside the uterus, that is your inner lining of the uterus, which is what you bleed every month. It's a new fall thing which forms every month, becomes nice and spongy, ready to have a pregnancy. If you don't get pregnant, the entire lining comes out as bleeding. That's what every month would happen to you typically. Now these cells, which are responding to your ovary hormones every month and bleeding, can sometimes start growing outside of the uterus, outside of where it is normally supposed to be. So they could come and affect you at the back of your uterus. It could affect on the ovaries, it could affect the tubes, and it can cause painful, heavy periods. The most common symptom found is extreme pain, which is not the typical pain you get with normal periods, where it's just a day's period, you take a little bit of rest, take one tablet and you're feeling fine. This is the pain that starts before the bleeding actually starts. It goes on for 2 to 3 days till your bleeding is on, and often sometimes patients, because of this pain for a long period of time, have actually developed what is called as chronic pelvic pain, which means the pain is just not going away. It's there every single day. The pain radiates to the legs, it radiates to the anal area, it radiates to the back. It's not just the tummy that is hurting, and this pain is so intense that you can't do your regular activities. You would have girls coming up to us and telling us that they fainted because of pain in school and were given injectable things, and this is not normal pain. So the main thing that endometriosis causes is pain, very heavy periods, and because it causes so much of damage inside on the main fertility organs, that is the ovary and the tube, they cause infertility in a lot of patients. I wish I knew. There is a lot of research happening on why endometriosis affects only some people and does not affect some people. There is a theory to say that there is an genetic inheritance, that there were, 1 in 7, it is a 1 in 7 chance if your mom has had endometriosis, you will probably develop with that. But we don't know the exact reason. It is the estrogen hormone, which is actually a boon for women normally, is what is acting up and causing endometriosis to proliferate and grow faster. But why does one person's immune system recognize this as abnormal and destroy it before it becomes a problem, and there is some whose immune system does not recognize it, allows it to grow? Now that is a enigma which is not yet solved, but yes, a partly genetic predisposition we know about, and we also know about the fact that immune system has got some role to play in why endometriosis would occur. Yes, like I said, endometriosis, if your mother or mother's sister or someone in the family has had endometriosis, you have a 1 in 7 chance that you will develop endometriosis. So there is a Mendelian inheritance present with endometriosis, and yeah, your sisters could well have it. So if you have it, you would want to get your sisters and everyone, all your siblings, your mom and your other siblings checked to see if they are actually having endometriosis. The most common symptom, it starts off with usually pain which is uncharacteristic. It is much more than normal pain which you get with normal period cycle, which is a day's pain. And this pain would be excruciating enough to get you to actually stop going from work. So you would have to take a days off and sit at home and not do your routine activities, or if you're a housewife, you can't continue normal stuff. And often you'd hear patients saying that the pain is so bad on the first day that she just lies down and doesn't do anything the whole day. So it's like one entire day's working lost because the pain is so intense. The pain radiates. It is not just in the tummy, it goes up to the legs, goes around the anal region. It also associates itself with some amount of heavy bleeding. The heavy bleeding usually starts off a little bit later in life. The pain is usually the first symptom. The heavy bleeding occurs whenever the uterus is also affected. So if you see endometriosis, the black mark that grows out here into the muscle of the uterus, which is called the adenomyosis. This adenomyosis is responsible for heavy periods because the uterus bulk itself increases so much that it starts causing very heavy periods sometimes which are lasting for longer time. So you will often have patients who will complain of spotting, brownish reddish color spotting for 2-3 days before the actual period is actually started off. The period itself usually is very heavy, painful, lasting for 3-4 days, followed by some more spotting happening later. Infertility is also a big marker. Often enough, patients who are not having so much of pain or have not recognized the pain as being a problem, and they get married and want to have children and they can't, and that's when they get diagnosed with having endometriosis, because the endometriosis can affect your ovaries. It can go and affect your ovaries and form cyst inside it. It can affect the tubes and cause swelling of the tubes. If there's a swelling of the tube that's occurring, this is the conduit where the egg is going to go into the uterus, and if that is lost, obviously getting pregnant becomes very difficult. Also, because there is so much of blood around the uterus, there's a lot of swelling or inflammation as we call it, and these inflammatory markers or hormones that are secreted because of endometriosis do not allow the egg to function normally. The sperm also gets deactivated because of which. So pain, heavy bleeding and infertility are the 3 main symptoms of endometriosis. So endometriosis is essentially the uterus lining, which is what you bleed every month with your periods, growing in different areas which is not supposed to be growing. So logically, every time when you have your period is when you potentially can develop endometriosis. So the age can start from the time when you start your periods to the time you actually finish your periods. The most common age is between 25 to 45. Usually that is the most common age group, that is a reproductive age as we call it, where a woman would generally be looking at getting pregnant, married, having intercourse, all of those things. So this is the time when endometriosis actually starts. There is a small section of patients who are adolescent endometriosis, which means younger than 20 years of age, who also develop endometriosis much earlier on. The moment they start their periods, it starts off. And then there is a group of patients who even after having, so technically when your period stops and you become menopausal, endometriosis should not bother you anymore, which is what happens 90% of the times. But then there is also a small section of people who even after having become menopausal would still, because of different other reasons, have problems of pain or bleeding from the endometriosis. So endometriosis basically most commonly is in the reproductive age, which is between 25 to 45. So birth control pills are again hormones which are going to control the amount of bleeding you get, and essentially all therapy, medicine therapy which is meant for endometriosis is essentially meant to reduce the amount of bleeding you're having through your periods. If you bleed less with your periods, if your hormone levels are low, this is conversely also going to stop the growth of the bad endometriosis or the bad endometrium which is growing where it's not supposed to grow. So yes, oral contraceptive pills which reduce the level of estrogen in your body will reduce the growth of endometriotic spots inside the pelvis. Oral contraceptive pills are one of the spectrum of medications that are available. There are a number of them which are there, which could be just on medications, could be combined pills, so on and so forth. But yes, OC pills, if you were taking the low dose ones, they are actually recommended. Though the cycle of taking it is slightly different. We don't give it in the regular way that you would normally take it for contraception. There is a different method of taking the oral contraceptive pill, but that would definitely help with endometriosis, yes. No, not possible to prevent endometriosis. If it has to happen, it is there in your genes, it is there in your immune system. It's going to be very hard to actually prevent it. Though it's possible for us to perhaps delay the onset of endometriosis or reduce the, let's say, the effect of endometriosis if you were to conceive or have children early. So it will only delay the onset. So, or it may reduce the severity of your symptoms to some extent, because you get a break. When you get pregnant, you have hormones in the body which don't allow endometriosis to grow. And then when you're breastfeeding, so you get a 2-year break where you are quite settled with regards to the endometriosis. And then post that, it kind of starts off once again. So, Yes, you can prevent endometriosis in a way by making sure you've had, pregnancies, but really that does not stop somebody who's had 4 children to not have endometriosis at 40 years of age. I mean, that happens as well. So essentially nothing really much done to prevent. If you are bound to develop endometriosis, you will just have it. So chronic pelvic pain is generally defined as pain which is debilitating throughout the month cycle and for a period of more than 5 years. And yes, if someone who has had endometriosis, there's a lot of fibrosis. Fibrosis is hard, tough tissue. You know, if you get a cut somewhere which is deep enough, or say if you've had burns, if you see your skin, it gets hard when it's healing. That's called fibrosis. That means the normal smooth skin tissue is now replaced by a hard tissue. That's exactly what happens in endometriosis as well. There's a lot of fibrosis. There's a lot of things which are stuck to each other. So intestines get stuck to the uterus, the urine pipes get stuck to the uterus, and when they are healing, there is fibrosis. And these fibroses can actually cause chronic long-term pain because they trap nerves inside them. And chronic pelvic pain is one of the sequelae or the consequences of having had endometriosis for a long period of time. No, not really. Heavy bleeding during periods can be from just mere small hormone changes in the body, sometimes thyroid not being overactive or underactive causing heavy periods, to having fibroids. You know, you got these muscle-like growths inside the uterus called fibroids, which can, if they're growing inside the uterus, there's a polyp here, there's a fibroid here. These are things which can cause heavy periods as well. But heavy periods in endometriosis would occur if the endometriosis is growing in the muscle of the uterus in this manner. That is called adenomyosis. That's a spectrum of endometriosis which is occurring in the muscle of the uterus. So heavy bleeding, if the patient complains of, we would want to look for endometriosis, but that is not the only reason why. Endometriosis is one of the unique diseases which has actually taken across the world almost 7 years for diagnosis. And the reason being because our normal imaging findings or our normal clinical acumen is not equipped enough to pick it up. Right? The main pain symptom that I said was symptom of endometriosis was pain. Now, pain is something which is very subjective. You know, a person A would have a lot of pain but actually have no disease, and it's just her temperament. And there might be a person B who's having a lot of disease but is resilient enough to not complain about the pains. Because it is so subjective and cannot be measured, we are not able to judge very well as to whether this one is a genuine or not a genuine pain. Then what happens is, even if the patient persistently complains of pain, so then the first thing to do is let's get an ultrasound done to check what's going on. What happens then? You don't find anything because ovaries are involved in endometriosis only 60% of the times. The nerves around the uterus, at the back of the uterosacral ligaments, these are the ones that are involved with endometriosis, causing severe pain but cannot be diagnosed on ultrasound or even on MRI. Even there are endometriosis which affect the pelvic nerves, the nerves which come out from your spinal cord and are going and supplying all the organs in the pelvis. Those nerves can also have endometriotic spots on them, and these are things which will not be seen on MRI, which will not be seen on ultrasound. So, you know, a young girl will come to you, she'll say she has pain is so bad, she's taking medications, they do a scan, they see nothing is there, uterus is looking normal, ovaries are looking normal. So then you say, okay, this is just, you know, normal pain, take a painkiller, it'll get better, and they dismiss it. It's only when the pain gets so excruciating or starts developing other symptoms, or hang on, immediately with pain you find a cyst in the ovary, then yes, the diagnosis becomes immediate. But generally, because of the pain not being something I can quantify, and because of poor diagnostic tools available, no specific your ultrasound or MRI is going to diagnostic it, be very accurate in telling you that there is endometriosis or not. And the insidious way it comes up, endometriosis can come up everywhere. It's not just in the ovaries. That's the reason why it often gets mixed. So you need to see a person who's sensitive towards endometriosis. And I would say thoroughly check a patient who has pain, who comes to you with pain, and not dismiss it, because there may be an element of endometriosis here which you're missing out in the earlier days as well. Depending on how much of organ and how much of part of the pelvis it affects, it has been classified into a stage 1, stage 2, stage 3 and stage 4. Of course, stage 1 being mild deposits which you see around the pelvis. Stage 2 being some involvement of the ovary and the tube. Stage 3 would be a little more involvement of some other organ inside the pelvic cavity. And then stage 4, of course, is what is called as a frozen pelvis, where the uterus is completely buried under things which are stuck to the uterus. So the bladder comes in the front, the intestines come at the back, the tubes are swollen and stuck to the side walls, the ovaries are stuck, they have cysts in them. That's the worst form of it, which is called a grade 4 endometriosis. So, like I said before, when you have endometriosis, you have these blood clots which are growing in the ovary or the tube. Now, when a patient wants to get pregnant, there has to be a very good environment for the sperm to travel up into the vagina through the uterus right up to where the end of the fallopian tube is. This is because this is where the egg is getting released. If your ovary has endometriosis, first thing, if your ovary has endometriosis, it has a cyst which has got blood inside it, the blood will not allow the egg to come out correctly. So there is no rupture of egg happening, or even if it is happening, the egg gets lost and never reaches the mouth of the tube. Also, often because of this swelling and inflammation, the ovary tends to get stuck at different places. It is not in its correct position. So it is not aligned to the fallopian tube at all. Secondly, what happens is the fallopian tube itself gets swollen. And fallopian tube is a very delicate organ. It has very tiny little ciliary processes inside it which actually push the egg into the uterus. And if there is any infection, any blood that happens in the tube gets affected very quickly. So if the tube is swollen and has blood inside it, endometriosis inside it, the functionality of the tube gets completely nullified. So therefore, that becomes the most common cause. The other thing is pain. Now, a lot of times patients will complain of deep intercourse pain. So it's called dyspareunia with us, which means whenever they have intercourse, penetrative intercourse, which is deeper, the pain is coming deeper inside. That's because just behind the uterus is where the penis would come in, and there are uterosacles or big strong ligaments which support the uterus, which have a lot of nerves. And whenever there is a blood clot sitting on this, it is extremely painful. So they're not able to have an intercourse. They get scared of having intercourse because there's so much of pain around there. If the urine bladder and the stool and the intestines are involved, again, having intercourse would be an extremely painful process for them. So all of this actually makes them not wanting to have intercourse at all. There are also a lot of inflammatory markers, like I said before, a lot of cytokines, interleukines, which are in this environment, which are actually toxic to the eggs as well as to the sperms. Yes, the first line treatment for all endometriosis always is medication. See, because endometriosis is a lifelong thing. I said it's from 25 to 45 years of age. So it's 20 years of management of pain, fertility, bleeding, everything for a patient. And you can only operate on some things, not on everything. So the first line treatment generally for young people would be oral contraceptive pills, only progesterone medications. There are other injections which are available which can shrink and reduce the intensity of the endometriosis. So yes, medications will not cure it. Look, there is no cure. So I mean, it's a wrong thing to say that there will be a cure, because through the world we don't know how to cure endometriosis. All I can do for you is to make your life livable so that you don't have so much pain, you're not having bleeding, you're able to get pregnant. We achieve that. But at any point of time, if medications are stopped or treatments are not taken, endometriosis can always rear its head back. So it's often, enough we find patients who've had surgery and would not, say for whatever reason, would not follow up and would not have taken the hormone medications for long enough. They find that in 3 years' time, they're just back to square one. Everything just grows back and starts causing trouble once again. So yes, medication is the first line treatment, but it has to be a continued medication under good supervision. And there are a variety of things available. So it's not like I'll have side effects of oral contraceptive pills and I can't take them. There are newer progesterones available which are actually very good. They tolerate it very well and they effectively take care of endometriosis as well. So medication is always the first line treatment. It's only in certain circumstances where either a fertility is desired or medications don't work is when surgery is advised to the patient. So these are abnormal deposits. These are blood clots, abnormal endometrial lining which is growing outside of the uterus. we do what is called excisional endometriosis surgery, which means we are basically plucking out and clearing out all the abnormal growths around the pelvis which is there, whether it's in the ovary or the fallopian tube or around the uterus. So we are basically cleaning all of this up so that there is no extra abnormal growth of endometriotic cells or lesions present inside the pelvis. That's how surgery helps. So it would help to correct the ovary to get it back to its normal position. It would restructure the tube. It can help to reduce the bulk of the uterus, which is causing painful periods. It can reduce the blood clots which are present on the uterocircles causing pain. And preserving fertility, because presence of the ovarian cyst which has endometriosis inside it actually kills your eggs. So by removing that, you're actually conserving your eggs much better. So surgery would be the treatment of choice if there is extreme pain and the patient is opting for a fertility management. That's when surgery has a very big role to play. Endometriosis treatment is an ongoing process. It's almost 20 years, so it's difficult to say how long. Through the practice, what we found, we've been doing this for a few years now, 11 years here in Kokilaben and 4-5 years before that. There are patients who respond well to treatment and don't require too much of hormone medications for a longer period of time, and there are people who have recurrences very quickly. So it's very variable. We don't really understand the disease much, but I would say that if you have endometriosis, you would have to take some hormone therapy off and on for till the time you attain menopause. I think that's pretty much what you would require to do. Yes. Endometriosis leading to chronic pelvic pain, dyspareunia, which means painful intercourse, infertility, all of it. Chronic pelvic pain is one of the most common things which actually lead up to patients. Like I said, pain can't be quantified. It's a very subjective phenomenon. And patients constantly complaining of pain often will not be understood very well by everyone around them. And that does cause a lot of psychosomatic changes. Patients start complaining of other things, and yes, they can have depression because of the pain. Also, because sometimes the pain is not recognized. So, the patient has been going everywhere else, and I have so many such patients who tell me that I've been everywhere. Everyone just keeps telling me this, and I was getting so frustrated and thinking, what's wrong with me? Why is everyone telling me my pain is fine? But it's not fine. I'm having so much pain that I'm not able to do things, and people put it down. Even in the office, they would put them down to say, okay, you just want a holiday. That's why you're not coming in. Things like that. So these influences that lady quite a bit. She's suffering, and then nobody is able to understand the suffering. So yes, it does cause a lot of psychological impact. Yeah. A lot of them. In fact, like lifestyle would affect everything else, it affects your endometriosis as well. It's a long-term struggle. It's a 20-25 average year of struggle of dealing with endometriosis. Medications will help to suppress it. Surgery will help to probably treat and eliminate it out of your system for some time. But what's going to help it to keep it off? So you've taken the treatment, you've done the surgery, but now how do I allow it to not come back to me? Lifestyle, in terms of being active, doing some amount of cardio exercise, about 30 to 40 minutes every day, helps you to release endorphins. These are ones which will actually help to reduce your pain signals coming from the uterus. So you find that your tolerance of pain improves and your dependence on painkillers reduces. It's not that you are then killing your kidneys because you're taking too many painkillers. So exercise helps you to develop your endurance. It helps to develop your resilience, and your sensitivity to pain reduces. So your dependence on painkillers reduces. Also, there's a lot of diet which is shown to actually reduce inflammatory responses. So avoiding gluten and dairy about a week before your period helps to reduce inflammatory changes which happen with the periods, and therefore the pain also reduces. So yeah, these are the two essential things which actually help in maintaining or managing endometriosis. I generally tell them to avoid having gluten and dairy a week before their period onset is due, because that reduces inflammatory changes. Generally having a high fiber diet, a lot of omega-3 in their diet, and a lot of fresh fruits and vegetables, less of red meat, because red meat has a big source of estrogen. Soya also, which is a very big source of estrogen, should be avoided. No, it doesn't. And I'm so happy you brought that up, because that's a myth. It's a myth, and it's a myth which kills women, because you've been career oriented and you're like 33, 34 and developed endometriosis, and now everybody's telling you just get married and this is going to take care of it all. And pregnancy does not cure it. It just gives you a stopgap. This is a disease which is formed even in young girls. It is formed in women who have had 4 children at 40 years of age also. So how does pregnancy actually prevent? It doesn't prevent it. It only gives you, it does not alter your immune system. It only gives you that gap, that 2 years of gap where you're not taking medications for your pain and periods. But it's not going to take care of, it's not going to cure your endometriosis by any standards. Yes, it gives you a gap, and because you get pregnant earlier on, you have taken the chance of being pregnant easily without depending on IVF and other things. So like say if you had endometriosis and your ovaries are young and healthy, and you got pregnant at 25, obviously your chance of getting pregnant was bigger then. But if you had endometriosis and you would be putting off getting pregnant till you're 35, I mean, nature kicks in as well, and therefore your chance of getting pregnant reduces at that point of time. And that's pretty much all that I would say would correlate with endometriosis. But pregnancy is not going to cure it. It just gives you a stopgap, and that's about it. So even those people who may want to consider pregnancy at a later point of time, we have an IVF department in the hospital that does ovarian conservation, and that is offered to these patients because they've had generally multiple surgeries on the ovary. Eggs tend to start getting depleted very quickly. So if you want, you can conserve your eggs, keep them, and we can use them when you are ready to have a child. So no, pregnancy doesn't do anything of the sort at all. One of the most, I would just like to say this, the organ which is affected quite a lot with endometriosis are the ones that are close to the uterus. So you've got the urine bladder in the front, and you've got the stool passage at the back. Untreated endometriosis around the intestine sometimes can actually make the intestines very, very narrow. There will be a big nodule sitting on top of it, and the lumen of the stool passages become so narrow the patient has constipation, not able to pass stools at all, and has to take multiple medications just to be able to pass some amount of stool. So the chronic constipation becomes an issue that if you had not taken care of your endometriosis, that will get affected. The other thing, very sensitive thing, is the urine bladder in the front of the uterus has these pipes which are going up to the kidneys inside your body, and the urine flows from the kidney to the urine bladder. The urine pipe actually flows right there, right next to the uterus, and coming up to the urine bladder in the front. And if you have endometriosis, generally endometriosis will grow here, and if it's growing here, it's actually trapping that urine pipe. And we've seen patients who've had silent hydronephrosis, which means the endometriosis encased that ureter. Ureter is the pipe which comes from the kidney to the urine bladder. It encased it, made it tighter, did not allow urine to pass out quickly, so the pressure built up back and swell up the kidney. So they actually come up with their kidney function being lost because they didn't diagnose endometriosis earlier enough. And I think that's the most significant or a problematic and a significant thing, which I think every patient with endometriosis should always have an ultrasound which includes a scan of the kidneys. It should never be just pelvis, because that's the most common thing people would do, just check the uterus and ovaries. But no, you must always have the kidneys checked out as well, because silently hydronephrosis and actually loss of the kidney function is seen with endometriosis. I hope our session has helped you understand this enigmatic disease a little better, at least created a little bit of awareness and curiosity, and you would want to seek help about your painful periods and heavy periods as well. World Endometriosis Month is the month of March across the world, where numerous women come out with their stories, and we would also like to highlight a few of our patient stories in the future, which would help you to understand endometriosis, understand symptoms, look out for it. And it's very essential that you need not tolerate the pain. We need to stop the pain and ensure you get treated early and correctly. Thank you so much.